like depression, or even sleeplessness, or rejuvenation, getting your energy back, reducing anxiety and fatigue. So there are many yoga poses that do that. The pose I'm going to talk to you about now is called the bridge pose. And the bridge pose is an invigorating stretch for the chest, neck, and spine. And some of its benefits also include calming the mind, alleviating stress and mild depression, stimulating abdominal organs and lungs, thyroid, rejuvenating tired legs, improving your digestion. Maybe that will also improve your appetite if you're having appetite problems. Reducing anxiety, fatigue, backache, headache, and insomnia. So these are all things that this pose can help you to do. It's also been thought to be therapeutic for high blood pressure, sinusitis, and so forth. So, now that we know the potential benefits of it, let me, if you're not familiar with the bridge pose, explain how you do it. Now, the bridge pose is originally called, in Sanskrit, Setu Bandha Sarvangasana. Setu Bandha Sarvangasana. And that translates literally to construction of a bridge, because your body looks like a bridge when you do this pose correctly. So how you start is you lie on the floor, and if necessary you can have a folded blanket or yoga mat under your shoulders to protect your upper back and neck. Then bend your knees and place your feet flat on the floor, parallel, no more than hip width apart. Your arms are at the side of your body, palms on the floor. You breathe in, then exhale and slowly lift your hips towards the ceiling. Keep your knees and thighs parallel. Engage the muscles of your lower back, buttocks, thighs, and abdomen to keep your body taut and firm. Lift the hips until the body is flat from the chest to the knees. There's your bridge. You keep your neck loose now by lifting the chin away from the body. So lifting your chin away from the body will help you avoid placing too much strain on your neck. So you maintain this pose for 30 seconds to a minute, and then exhale and slowly roll your spine down from the neck and ending at the hips, one vertebrae at a time. And then repeat that pose one more time if you feel comfortable. And that's it. Doesn't take very long. Now, this pose is and should be part of a yoga routine if you're into it. So you have many different poses, or asanas as they're called. But if you're pressed for time but you need a little something to reduce your stress, this is quick and can do it. So here's a little more information here that I'm getting this by the way off of the health and wellness section of drweil.com. Yoga poses that focus on the lower back, such as the bridge pose, have been shown to alleviate back pain. Investigators compared the effects of yoga and physical exercise on patients who experienced chronic lower back pain, and during a 7-day period, investigators found the patients who engaged in yoga had a greater improvement in their spinal flexibility and reduction in lower back pain than those patients who engaged only in physical exercise. So some of the things that you want to try, if you've never done yoga before and you're trying this bridge pose, you want to keep the shoulders rolled under so that you don't overstretch your neck. And lift the top of the shoulders towards the ears and push the shoulder blades away from the spine. You might want to start with a yoga block if you have one of those to alleviate pressure on the back. Now, if you've been doing yoga for a while, you can actually add a couple of movements to deepen this pose. One way is to extend your arms and place them above the head with the backs of the hands and arms on the floor. This movement engages the muscles of the body by reducing stability. Advanced practitioners can lift the heels off the floor and lift the hips higher. You should be careful, though, if you have knee, back, or neck pain. You'll want to, check in with your doctor before you do something like this, because we don't want you to hurt yourself. You want to ensure that your shoulder blades are supporting your full weight and not your neck. So it's recommended that you place a folded towel or yoga mat under your shoulders to prevent slipping on the floor and to reduce pressure on the neck and shoulders. As you do the bridge pose, you can also interlace your fingers, place them under your buttocks, and press them down into the mat. I believe that was the first way that I learned to do this bridge pose. Now, there are other poses you can add to it if you want to make a yoga routine. There's the cobra pose. There's upward facing dog. And then there's the upward bow or wheel pose. And I don't have time to go into those, but you can look those up for sure if you're interested in adding more. But the bridge pose can certainly help you in a variety of important ways, if you are dealing with some of these summer issues, or even if you're just, you have some mild stress or some, fatigue or backache. It can help. So let's talk about some other wellness therapies quickly before our show has to wrap. Okay, so one wellness therapy that we've talked about, certainly besides the approaches that I've talked about at the beginning of the show regarding how you deal with stressful information in life, another approach is hypnotherapy, which you might have heard of. Some of you may have been involved with. Now, I've seen it work. I've seen people who use hypnotherapy and have used it for a major operation, surgery, in lieu of anesthesia. It's amazing. And these people are pretty well trained in it and seem to be able to eliminate any pain. But we're not going to talk about that aspect of it right now. Just a general definition of hypnotherapy, sometimes called trance work. It's a group of techniques that allow practitioners and patients to take advantage of the mind-body connection to foster healing. It's essentially an altered state of consciousness marked by decreased breath and increased intensity of awareness. What distinguishes hypnotherapy is that it involves a deliberate choice to enter this state of consciousness for a goal beyond relaxation, to focus concentration and use suggestion to promote health and healing. Individuals can not only experience hypnosis from a licensed practitioner, they can also become comfortable practicing and eventually mastering the techniques themselves. While the practitioner serves as a teacher or guide, the only person who can hypnotize you is you, since trance is a latent potential of your own mind. Therefore, all hypnosis is really self-hypnosis. So hypnotherapy can be effectively used to treat a remarkable range of health conditions, as a matter of fact. There's been research that has shown dramatic results with dermatology and gastrointestinal problems, as the skin and the gut are areas of the body where stress is commonly expressed. Hypnotherapy can be effective in dealing with weight loss. I've heard a lot of people using hypnotherapy to do that. And to help reinforce with motivation, self-discipline, and willpower. It's often used to help people change their behaviors. Like big use of it was to get people to stop smoking, or eating too much. You can also change your behavior around your physical activity and other areas that you might want to change. Suggestions offered to your subconscious mind during a hypnotic trance can remove the psychological obstacles and strengthen the ego, as well as encourage changes in body image, metabolism, and body mass set point. It can also be used to help ease chronic pain, which seems like a real important tool to use. It can also be used to lessen the side effects of chemotherapy, alleviate symptoms of autoimmune disease, and counteract anxiety and sleep disorders. Hypnotherapy can be used to improve performance as a form of analgesia or sedation for medical and dental procedures, and even to help stop bleeding in accident victims. It can be used for burn therapy. That's something new. I didn't realize that. But yes, apparently, according to the American Society for Clinical Hypnosis, burn therapy to help reduce inflammation and pain, and to promote healing. Nausea and vomiting associated with pregnancy and childbirth, allergies and asthma, high blood pressure, many things. It's interesting. So, if you go to a practitioner, here's how your first session might go. It might start with a great deal of talking. So the therapist will ask you questions to get some insight into what motivates you and what your beliefs and expectations are. And when that dialogue is done, you'll be taught some kind of induction technique. So this is how you get into the state of hypnosis. So, if you've seen some of these old movies, they use a swinging pendant or watch, and the doctor says, "You are getting sleepy. Well, that's the induction technique. It's a focal point that helps you concentrate your attention. It can be an internal one or an external one. Obviously, the watch is an external one, but one that's often used today is closing your eyes, just sitting upright in a chair, and pressing your thumb and fourth finger together while your eyes are closed, and holding your breath for a count of 5, and then releasing the breath and fingers, and letting your mind drift, and developing pictures and images to accompany the words that the therapist begins to speak to you. Some people go into trance very easily, and some show a great resistance, but it just really depends on your personality. And oftentimes it's a lot about trust issues and defensiveness. But anyway, once you're in that state, the therapist will offer suggestions geared to the goal of your therapy. So if you are someone who has a problem with your digestive system.